back in the day, we used to have home economics, and I don't know if we still have that.
I remember that.
School systems have been trying to decrease recess, decrease physical activity, decrease the musical arts. And so it kills me. It pains me because these are essential skills. What the pandemic has shown us is that, if you did not have these skills to begin with, then you are reliant on outsourcing is what I call, and to me, what I teach people is your health starts in the kitchen.
This is the Healthy Lifestyle Solutions podcast, and I'm your host, Maya Acosta. If you're willing to go with me, together we can discover how simple lifestyle choices can help improve our quality of life and increase our longevity in a good way. Let's get started. Welcome back, friends, to another episode of the Healthy Lifestyle Solutions podcast. I'm your host, Maya Acosta. And before I introduce today's topic, I want to tell you about a couple of changes I'm making to the podcast. And that's mainly as a result of my feeling a little overwhelmed with so much on my schedule. First, I want to remind you that for the most part in the month of June, I was releasing an episode almost every day. I went to the Vegan Women's Summit and I did all these interviews that I wanted to share with you. And so most of them that run from Wednesday through Friday were recorded live on location. And those interviews were with some of the leaders and speakers of the Vegan Women's Summit. So I hope that you got a chance to listen to those. And so now I'm switching the format. You know that I have an episode every Monday called Doctor in the House with my husband, Dr. Rizwan Bukhari. And so I'm going to keep that segment every Monday when possible. Most of the time, we are going to have Dr. Riz as our guest expert here on the show. We recently completed a 4-part series on Blue Zone Living that you might want to check out. And so I'm going to keep that every Monday. What I'm going to switch is my interviews had been falling on Tuesday, typically for the last couple of years. And I'm going to move those to Wednesday. That way I can space out my episodes a little bit more. And so Monday will be with Dr. Riz. Wednesday will be a guest interview. And if I have a third episode, it'll fall on Friday. That way the episodes are more spaced out. So that's going to be starting June 26th. That'll be June 26th, 28th, and 30th. I have episodes. And then July 3rd, 5th, and 7th, I have episodes. So I am going to be keeping 3 episodes for the next few weeks. And then I'm switching to 2 episodes again, Monday and Wednesday. Now, this coming weekend, we're headed to Cleveland, Ohio for the NHA. That's a National Health Association conference that's happening where they will be celebrating 75 years. And I do plan on sitting down with Dr. Riz and speaking to you about our experience at the conference. That way you'll know what to expect next year if you're interested in going. Keep in mind, there's also a virtual component as well. And so lots of great content coming up. I would say that as of right now, I have content scheduled to be released all the way through August. So I do stay pretty busy. And I'm hoping that after going to NHA, I'm going to have a lot of more possible interviews to conduct and then to release. All right. So going into today's episode, you're going to hear myself, Dr. Riz, and our friend, Dr. Colin Zhu, talk about a project that we're working on together. And so I hope that you enjoy this episode. All the links will be in the show notes. We do talk about a workshop that we will be conducting on July 22nd. I don't have that link ready yet to record, but I will include it in the show notes and in future episodes as well. Please tell me what you think about today's episode, and I hope that you enjoy. All right, friends, welcome back to another episode of the Healthy Lifestyle Solutions podcast. I'm your host, Maya Acosta, and I have
Dr. Riz.
Dr. Rizwan Bukhari, and also Dr. Colin Zhu. Hi, Dr. Zhu.
Hi. Good morning, afternoon, or evening, depending on how you're receiving this.
Right. Okay. All 3 of us are coming together to present to you a collaborative experience. And I'm going to first tell you about a workshop that we're working on. I'll read a little bit of a description, and then you get to meet all of us individually. We'll talk about what we bring to the table when it comes to this workshop that we are working on. What do you guys think?
Sounds like a plan to me.
We are so excited. As you know, Dr. Riz and I are here in Dallas. Dr. Zhu is a friend of ours who's also trained in lifestyle medicine. He's in California, and we've been brainstorming ways that we can help, meet some of the needs here in the Dallas area, especially when it comes to teaching you about culinary medicine, food as medicine, and of course, that aspect that we talk about a lot on the podcast, which is lifestyle medicine. So we came up with a workshop that we'll be offering here in Dallas on July 22nd. You're going to learn all the details about that today and what you can expect. And it's titled Nourish Your Health, a Culinary Medicine Workshop. So let me go ahead and read a little bit, and then you'll get to meet the doctors that are going to be part of this program. So join us for enriching and transformative experience at the Nourish Your Health, a Culinary Medicine Workshop. This immersive workshop offers a unique opportunity to discover the power of whole food, plant-based nutrition in optimizing your health and your well-being, led by esteemed physicians, Dr. Colin Zhu, also known as the Chef Doc, and Dr. Rizwan Bukhari. The journey begins with a guided grocery store tour, which will be led by Dr. Zhu. He'll show you how to navigate through the aisles, unraveling the secrets to selecting quality produce and making informed decisions. And we're going to talk about why that's important. But I will say that when I first went whole food plant-based, I did not know that I was supposed to hold off on choosing the bananas that were ready. And sometimes people don't know when a produce is ready to be consumed. Like if you buy tomatoes for that day, you sort of have to know how to pick them for that day. And also avocados can be very tricky.
Yeah. I mean, that's still tough for me, and, picking for that day versus having some ready for a few days later.
Exactly. So explore the vibrant world of plant-based ingredients, uncovering their nutritional benefits and mastering the art of label reading, which can also be difficult. Most of us don't go to school to learn how to read labels on our, food labels. So this is a hands-on experience that ensures that you'll feel confident and empowered to make healthy choices whenever you shop. We're going to return to the workshop venue, and Dr. Zhu will lead an interactive culinary workshop and meal preparation session. And I'm going to hold off on the details. I want him to tell you what he's going to be teaching you. And then the most wonderful part of all this is that we get to sit down as a community after the meals have been prepared, and we get to eat together and meet one another.
Yeah, how nice is that? Oftentimes when you watch these meal preps, you don't get to actually eat them. And I'm sitting there watching them make the food, and I go, when do I get to get a taste? And they say, no, we're not going to be passing that out. So that'll be nice to sit around the table and enjoy the food too.
Right. When you get to share about the details of what you'll be doing, you can talk about biometrics, and we'll conclude by telling you about continuing education credits that Dr. Zhu was able to make this workshop. So let's get started by first speaking to our friend, Dr. Zhu. Welcome again, Dr. Zhu.
Hey guys, thank you so much for having me on. Great privilege and honor, and super stoked because off camera, we guys have been very good friends over the years, and I'm very, very grateful for that.
I don't know how I communicated it, but I've known of your podcast. You've been on my radar in terms of all the things that you have created. I've read your book. I've taken your audio course. I pretty much follow a lot of the things that you're doing.
Yeah, we've downloaded his app.
That's right. You have an app. Okay, there's so much that we can talk about. So we're all over. Please tell our audience a little bit more. You have been on the podcast as well, but please introduce yourself to our audience.
Yes. Well, thank you for that, warm, memory, walk through memory lane. I actually didn't start my podcast until 2019. So I must have, you must have picked on something. I was still growing in terms of the Chef Doc platform. So, but I appreciate it. So. Yeah. So, hi, everyone. For those of you that do not know me, my name is Dr. Colin. I am originally from New Jersey. I'm based in Southern California. I'm the founder of the Chef Doc. And what do I do? A whole bunch of stuff. But what I love is really connecting, teaching, educating, and inspiring others through whole food plant-based nutrition, as well as different pillars of learning how to thrive. And I met these two lovely couple. They are pioneers in their own right. And when they're together, they are a force of nature. So I'm really, super stoked to be here, not just on this podcast, but our upcoming, venture together.
We're really excited to partner with you. And this is why we're doing this recording, to let all our listeners know that there's this partnership that's developing with Dr. Zhu. So he'll be coming out July 22nd, and this will be our first sort of event that we're doing together. And then let's talk more with Dr. Riz, in case you're not familiar with Dr. Riz, and then we'll tell you sort of the name we're all going under. But Dr. Riz.
Well, hi, everyone. My name is Rizwan Bukhari. I'm a vascular surgeon. Most people call me Dr. Riz. It's something my staff goes by, the patients go by. It's real easy. I always joked that I was hoping it would take on meaning like Dr. Oz, but it hasn't quite gotten that level of attention yet, but there's still time. So I'm a specialist in vascular surgery, and at the root of that is cardiovascular disease. And so I do a lot of teaching related to nutrition, whole food plant-based lifestyle, and lifestyle medicine, and its effects on our health. So I'm excited to be a part of this workshop and continued collaboration and relationship. My contribution is going to be in the area of cardiovascular disease. I'll be talking specifically about food as nutrition, and in particular some areas where particular foods that we can eat that help improve our cardiovascular nutrition. I'll also be bringing biometrics to our workshop, and we'll be looking at hemoglobin A1C and a lipid profile, which includes triglycerides, LDL, and HDL. So I think those will be some nice things to add, and we can talk about those results and understand that stuff a little bit better.
Yeah. And let's just mention the value of just doing that. And again, biometrics, you just described what that means. You're just be drawing a little bit. You'll be pricking a little bit.
Yeah. Okay. So I get to talk a little bit more. I'm
yeah, because I want people to understand what that means.
Dr. Riz is going to show up with a bunch of roses and,
well,
just like poke everyone.
Whatever it takes. Biometrics just means biological data. And I'm a big fan of biometrics, and there's all sorts of biometrics. It can be something as simple as a heart rate or a blood pressure, and it can be stuff a little bit more invasive where you draw blood. In this case, we're going to be using a finger prick method just to draw a couple of drops of blood, and we can get all that information from there. And I have the stuff to get the results within 5 minutes, so you're going to get immediate feedback. It's not one of these things where you get your blood drawn and you have to wait a few days to get the results. So we're going to have immediate results. And there's all sorts of biologic data, and I'm a real big fan of it. And we can even talk about that, where we look at all sorts of stuff. And with that feedback, you can make changes to your lifestyle.
If a patient were to visit their doctor and ask for this testing to take place, how much would that cost? Or does the insurance company take care of that?
It's so variable in this world today. Sometimes insurance covers it, sometimes it doesn't. It depends on whether it's ordered by your primary care. It depends whether you have an HMO or a PPO. There's so many variables that go into whether something's covered.
How much would this cost if I just went, if I wanted to? Okay, the reason I mentioned this is because I think in 2021, I just went ahead and ordered my labs using a website and went straight to, what did I use? I don't remember.
I think we used LabCorp. And I mean, the beauty is nowadays people are allowed to order a lot of their own labs online or go to a LabCorp. It depends on what state you're in, and that determines what labs you're allowed to order, independent of a physician. But at the same time, then you don't have the physician to help you interpret it. So a lot of people get these labs and then take them to their doctor and talk about them,
right?
Which I think is really the best way to do it. And there's again, getting back to the cost of what we're doing is probably a value of about $100.
Yeah.
So that's the cash value, whether, you get paid, whether your insurance pays for it or not. It won't, of course, won't for us. it's included in the workshop.
That's the main point that I wanted to drive is when we talk about how much it'll cost, and it's a 5-hour workshop. We'll go into more detail about what that all consists of, like the agenda, what things to expect. But what you'll be offering with this testing kit that we have is $100 value. Which if you went and did it yourself, and most people don't do a test like this more than once a year, probably, unless they're battling with something, right?
Right. Depending on if you have the diseases that we're looking at here, you might have it once a year or more often. Again, depending on what therapy you're on and what your doctor recommends, and also what your progress is. Okay.
So I'm very excited about that because, by the way, the reason we even have this kit is, some of you, if you've been following us here in the Dallas area for quite a while, we were working on many things in 2020. Those things came to a halt. And then now 2023 with our friend Colin Zhu, Dr. Colin Zhu, we are now kind of excited about reviving some of the programs that we wanted to have in 2020. And so having these testing kits is sort of part of what we had initially. And so in the past, our goal was to kind of give you a baseline of where your numbers are and then give you education as to how you can improve your health through lifestyle changes and then follow up with you 6 months later or a year. That was kind of like our goal initially in 2020.
Yes, so, absolutely.
Yeah. Okay. Dr. Zhu, would you like to add anything else about what we just discussed?
Well, yeah, I actually want to add, the values, for this, because I think, just to kind of reiterate, this is a 5-hour workshop. We're going to be going through a grocery tour. We're going to be doing a interactive culinary medicine workshop led by me. We're going to be demonstrating 3 recipes. Okay. We won't review that until, people actually sign up. And then, Dr. Riz is going to talk. He's going to do the screening. And then we're going to talk about other frequently asked questions and upcoming events. And the value from this is, you can go on YouTube and you can go online nowadays. You can just look up on how to, go through the grocery. You can look up on how to, clean out your pantry. But what you won't get is, all this that's led by, 2 board certified lifestyle medicine physicians. I personally, went through a lot of detours, after medical school because I felt like I was really ill prepared. So I actually enrolled myself into a plant forward, health supportive culinary arts school right after medical school. And so I didn't want to learn just about nutrition. I wanted to understand where food came from, how it's sourced, how different, flavors, taste profiles came together. And, I'm doing this with Dr. Riz, Maya, to be able to bring incredible value, for you guys. And, he just mentioned screening. How long, do doctors spend, talking with you after those results, like 5 minutes, even less, like very short. And you get to have us for 5 hours with 2 doctors, so it's an incredible value. And, that's why I wanted to add.
Exactly. That's wonderful. And as a layperson, I'll add what I bring to the table and the perspective that I think, I have as a layperson. So just like you, Dr. Zhu, and just like Dr. Riz, who also went on to learn about lifestyle medicine so you could be fully equipped to speak with your patients about the lifestyle modifications that they can make to improve their health. I too have always been invested in my health. That's where my money goes. And now us being together, I think it's pretty obvious, to my husband when in front of us, I have a whole bookcase of some of the books that I have, not all, because I rotate my books out. I read a lot. I'm very invested in learning all of this. As you know, I don't have a background in nutrition or I'm not a dietitian, but I feel comfortable with all that I do in terms of reading and educating myself. And Dr. Zhu, I might have mentioned to you that many, many years ago, as I too was trying to heal my own health, I did things from like paying to learn how to cook in a chef's house where we just watched the chef prepare the food in her own kitchen. And then we all sat down and dined and got to know each other. So that was a wonderful community experience for me. So I've done all of that. I've taken classes by actual chefs where I learned how to cook meat, believe it or not, because I didn't eat meat but I wanted to entertain my guests. So I've invested in classes like this in the past. And then the other thing that I did was I took the Ruby culinary course because I love being in the kitchen. So I'm really excited that you're going to be here, Dr. Zhu, because I get to see you work in your element, not your kitchen, but in your world. I get to see how you, because I've seen other people and how they cut and slice and all of that. And I feel like we lack everyday skills. Most of us that, have not been in the kitchen too long.
I think that's an important thing is that what Dr. Zhu is going to do for us here is in this day and age, a lot of people don't have kind of basic kitchen skills.
Yep.
And cooking skills because we live in a very mobile society and the kind of society where we do a lot of eating out, buying fast food and going to restaurants. And there's a lot of people where most of their meals are prepared for them by somebody else.
Right.
And then also when they come home, they often do kind of these fast preparation things, and which doesn't involve a lot of cooking. And what we're trying to teach people too is how to cook healthy foods for themselves. And so this is a very, very really important basic skill set that Dr. Zhu is going to be teaching. And then I think he's going to show how wonderful the food is too. So because again, people get to eat it when we're done with it.
Yeah, I think, I mean, what you guys iterate is super, super, important that I want to drive home is, back in the day, we used to have home economics, and I don't know if we still have that.
I remember that.
School systems have been trying to decrease recess, decrease physical activity, decrease the musical arts. And so it kills me. It pains me because these are essential skills. What the pandemic has shown us is that, if you did not have these skills to begin with, then you are reliant on outsourcing is what I call, and to me, what I teach people is your health starts in the kitchen because you know what goes into your food when you're cooking from your kitchen, and everything else is outsourcing. And so with this workshop, we want to teach those skills. We're going to be going over basic knife skills. We're going to be, touring through a pantry, how to stock a fridge, freezer, pantry, navigating through the supermarket, and very simple. We're not trying to be, on Chopped or Iron Chef. It's not a dramatization of that.
That'll be a later workshop.
Yeah, that'll be that'll be like a super secret ingredient workshop. But it's really about, that transition, learning essential skills, learning to cook with each other, your loved ones, and understanding what a family dinner, meal is at the end of the day. Because I think that we're also missing that in today's society as well, because we're so distracted.
That's right. And I want to add to that when you talked about the grocery tour, because I had forgotten what I was going to say. And now I remembered, which is a few years ago, Dr. Zhu, I was learning about how sugars and flours affect our health. And it was based, the grocery tour that I participated in was based on this particular book. And so I signed up for it. Someone led it at Whole Foods. And we went up and down the aisles and looked at the things that we need to stay away from. And this time in this tour, I don't think we're going to focus so much on what we need to stay away from as much as we'll focus on becoming more comfortable with how to navigate a grocery store and where to start. And there is one trick that I just want to throw out there that we all teach, I think, which is have food in your system before you go to the grocery store, and then have a list of what you want for the meals that you'll be cooking that week. Otherwise, it's pretty easy to just grab things, put them in the cart, and then a week later you're disposing of these foods because you didn't use them in your meals.
Yeah, I mean, that's important. I think be deliberate and have a plan, just like with anything else in life, right?
But believe it or not, that's a skill that a lot of us forget to use because, again, we live very busy lives. What do you think, Dr. Zhu?
Yeah, I mean, for most that don't know, when you're in a supermarket, it's really, how it's structured and laid out is very strategic. There's a lot of competing interests there, and they're all meant to derail you. And so you're going to be learning things about, real estate within supermarket, not the real estate that we buy and sell on, on HGTV. But we're not doing that. We're talking about real estate in terms of how these food companies have had to compete with each other in terms of getting your attention to buy them off the shelves. And so we'll talk about that in terms of how the aisles are set up, end caps, the impulse, counters in terms of cashiers, how to produce and, everything is set up there, how to read labels. What is the magical number in terms of number of ingredients to buy or put back on the shelves? What is considered an actual food and what's considered what I call a food related product? And so you're going to be learning a whole bunch of stuff. And, that right there is, I think is a true, huge value of the workshop itself, but we're going to be giving a lot. So.
Yeah. And I know that we're not going to have time to cover everything, but at least you get the gist of the things that are important for us to help teach you. And Dr. Zhu was recently on Chef AJ, and you were talking about food waste. And that's part of the conversation that we're just having right now, that a lot of times we're tricked by the marketing strategies that happen in the grocery store. We bring food home and then we waste a lot of food, especially because we either don't want to eat leftovers. We have this mindset that every day we should have a different cuisine from a different part of the world. Taco night, one night, you have Mexican, you have Italian the next day. And, you're just used to this mentality of eating out. And the kitchen experience has to change. It has to become more of, based on the skills that I've learned, what can I put together with what I already have in my refrigerator?
Yeah. I teach, individually in terms of patients and clients on how to repurpose leftovers, how to batch cook, how to, meal prep, how to put, certain things together. And that's a really good point that you brought up, Maya, is that 6 to 8% of greenhouse emissions is, coming from just food waste. And so if we can, reduce that, we're not contributing to that, because this is a very critical decade. And, and we will talk more about how, sustainable our individual practices are or not. And I think the pandemic has shown us a lot of clues that no matter what we do or not do, say or not say, it affects someone else down the road. And that also is also influenced by our individual choices, not just in terms of food and what we put in our system, but also in terms of the other pillars of lifestyle medicine and also, how that affects each other as well. I also want to define culinary medicine. You guys are probably, the ones that are listening, probably the ears are, they're perked up. So culinary medicine is defined as, the blending of the, arts, the culinary arts with the science of nutrition, and how that is used and applied to optimize someone's health. So it is, also, called food as medicine as well. But yeah, we're going to be teaching you that plus more in this workshop.
Yes. And now I'm going to bring it back to Dr. Riz. But before that, I want to give you a little bit of background for those listeners that are new to listening to the podcast, is that before the pandemic, I almost want to say, I use another term rather than saying that, but I myself, I have a background in education. So I have a master's degree in any kind of platform or job I've ever held. I've always been the educator. So I see things that way. When I'm scripting or putting together content for the podcast, I'm thinking like a teacher, like how I teach, how I would teach this content. And so that's sort of what I bring to the table, along with the fact that I've sort of become an event planner without really knowing that I was going to do that. But Dr. Riz and I were doing a lot of different things before the pandemic. So I was the person putting the events together, whether it was collaborating with our library or other people that I consider experts in our community, even people in the food industry that could offer whole food, plant-based. I would collaborate with them to bring everyone together so that you could have more resources as you're making this transition. One of the things that we did that I in terms of Dr. Riz, because he did, one of his missions had been to take this message of food is medicine to medical schools. And in 2019, we hit up several medical schools, if you want to talk about that. And yeah, please tell us more about that.
So yeah, we participated in at several medical schools. Particularly I went back to my alma mater, UT Southwestern. That was nice. I got to speak with the first and second year medical students. Mm-hmm. And in fact, it was back down in the exact same lecture hall that I spent my first 2 years of medical school. And so that was kind of exciting for me and brought back memories. But it was a good talk. It was well attended. We also went to UTMB in Galveston. Uh-huh. I recall that same year. And so one of our missions is to try to get the word out to our young doctors and doctors in training, so that it'll be a little bit different for our general population now. Back when Colin and I were in medical school, nutritional training and food as medicine were very little to none. I got 0. And I don't know, how much did you get, Colin?
I had 10 credit hours, and it was all biochemistry, and everything was like either a macro or micronutrient. So it was nothing.
And same for me. It was all physiology, and not, so we understand what a protein and a fat and a carbohydrate are, how many calories they are, and how they're metabolized, right? But we weren't taught about the actual, the bigger picture, which is how nutrition is. And, we can study nutrition at different levels, but we weren't taught about the nutrition in how to actually get those calories, those proteins, those fats into our body, and what's optimal. And so now I'm trying to, one of our missions has been to try to get that message to our doctors in training and medical students, so that patients today will have a better, or the patients of the future will have a better nutritional guidance. But I think the reality is, and Colin can attest to this too, is today if you ask 10 different doctors how to eat, you're going to get 10 different answers. And that's really a testament to the fact that none of them got any consistent training on what is optimal health and optimal nutrition, what's important at the basis of optimal health and nutrition. And so they're just really giving you their opinion based on the same cultural and experiences that they've had as throughout their lives.
Right. Yeah. And I want to add that by the time this episode airs, I will already have announced the Dr. Lori Marvis Eventbrite link. So as many of you, and I've teased about it on the podcast, that we're organizing an event for Dr. Marvis here in the Dallas area. We are collaborating with her as well in terms of, Riz will go into more detail as everything develops in terms of how you're working with her and more in medical. But what I want to bring up is that we do still collaborate and make other events that are available for anyone who wants to attend in the Dallas area. But what we've done with this event is we also have invited doctors, because for me, I've been very passionate about helping more doctors come on board to hear the message, to understand that there is power in eating whole food, plant-based foods. I want to add that you've been working on your end with people that you work with at the hospital, or even in a setting where you're in surgery. You spend a lot of time sharing the message to people that are willing to listen.
Well, yeah, absolutely. I mean, I think those of us who are in this space are very excited about what we do. There's a passion about helping people become healthier. It's not. This isn't just a silent thing that we are a part of. We want people to be healthier. I joke that I'm trying to put myself out of business, and so I'm pretty vocal about nutrition and how important it is to our health. And then fortunately, I work in a smaller community. It's real tight knit, so people kind of know about what I do, and when they are interested in the message, I'm very happy to share. And I work on it at several levels. I've tried to get the cafeteria that serves us food to offer healthy options, and that we have come a long ways in many years over that, which is in a positive way. And many people that I work with have transitioned to a more plant slant or plant-based diet. My CEO is very much on board for a healthier lifestyle, and we have conversations all the time. Our new CFO had just the other day came to me and said, Dr. Riz, I think I need to go vegan. And I was like, okay, well, let's sit down and talk. And so, I think that people recognize that there's a healthier way to live. And I think everybody knows that. And so then when they find out that there's resources or opportunities or people that they know, I'm happy to share. And my next big deal is to nutrition services. I don't know if they're happy to see me or if I'm a thorn in their side, but the next big thing is to try to improve the food we serve our patients.
Right. Oh my God. Imagine creating a change for that. Dr. Zhu, since we're talking about other professionals in healthcare, please tell us, who is this workshop for? And tell us about the continuing education eligibility that people can take advantage of.
Yeah, for sure. So the workshop is for not just people that are health and wellness oriented, that want to improve and optimize their health, that are curious about how to transition. I don't know where to go. I don't know what resources, there are. And what we've created is something very, very concentrated, led by, us three. And I think you have a whole package, but we also have the ability to make this, continuing education eligible. And, it is for basically, who can actually earn credits for our workshops is physicians, nurses, nurse practitioners, physician associates, pharmacists, dentists, and dietitians and dietetic technicians. And so, the content itself is, we go through an exercise, we go through a lot of reflective processes alongside the content we present. And it's a very streamlined process, as well as everything. We want to make it as simple as possible, and we wanted to make it as open as possible. So not only do you, learn and receive a lot of value, but you also can apply that towards your continuing maintenance of certification, whichever you have.
Oh my goodness. That means that if we have anyone in the healthcare field that it could benefit from continuing education, like our doctors, and you said like our physician associates, we can refer them to this 5-hour workshop. And how many credits do they get?
5 credit hours.
Wow. That is great. How many credits are people supposed to have every year?
I think it varies from state to state. I'm required to get 30 per year every 2 years.
Okay.
So I have to get 60 every time I renew my license. And there's some variety that's involved in it. So, hey, Colin, can I get credit for doing the workshop?
I'll just hand you it.
Unfortunately, I don't think we get credit if we put it on. I've done that before. I've tried. So, yeah, whenever I give the CME talks, I don't get to get a CME, which is really weird.
That is so funny.
Yeah. And for those that are listening, I'm sure you guys share this as well, is that it is sometimes a hurdle, just to, get the credits. You have to pay an exorbitant amount of money. You have to fly to XYZ conferences, which are really, really cold, and, sit through lectures that you may enjoy, not may enjoy. Mm-hmm. And we want to be able to bring a wonderful experience and also be able to, make it eligible for you guys. So this is just another option, especially in person as well. So.
Yeah, the value is very good. I sat there and calculated when I have to fly. I remember one time I had to fly to Phoenix to go to a Society of Vascular Surgery meeting, and I was getting 30-something credits for the entire meeting over an entire week. And when I sat there and I calculated it all out, it came out to several $100s per credit. That was airfare, hotel, car, registration, mm-hmm. and also income lost to me. And mm-hmm. And so this is actually quite a good deal.
It is.
Comparison.
And we're bringing it to you. This is the first of many collaborations that we'll have with Dr. Zhu. So he's coming out here for to make this happen for all of us here in the Dallas area. We can only take 10 participants. So we want you to be serious and in just as interested in getting involved in learning, even if you already have a little bit of background in understanding the power of, whole plant-based foods. I think it would be a great opportunity to come and build the community and network with other professionals if it becomes more professional than lay people. But I want to do a recap, and then we can talk about what people can expect in terms of how much it costs, how to register, and all of that. And then we can continue to add more information, more details if you'd like. So we're recapping in the sense that, we'll do an introduction. Everybody gets to introduce themselves and talk about what brought you here to the workshop, why you want to do the workshop, and even a little bit of background about yourself, if you have any health issues or if you work with patients and what you've seen. And then Dr. Zhu is going to guide us in the grocery store. We're all going to be there. And Dr. Zhu, I think you might have said that we will also be assigned food to purchase for the meal that you'll be preparing. Is that right?
Yes. So basically, when we're doing the grocery supermarket navigation, not only are you learning the anatomy of the supermarket, but we're also going to be assigning to help out in terms of, gathering all the ingredients for the workshop in the middle of the actual duration. So we could, see how, okay, if I'm grabbing this, what am I looking at? If I'm grabbing this, what am I looking for? And to be able to contribute for it, because it's going to be a collaborative event. Like, Maya and Dr. Riz has said, there's a lot of different types of cooking demos and workshops that have been put on before, but this is super, super interactive, very hands-on. And, how I like to teach and lead my workshops is really, hands-on, using all 5 senses, and we're working as a team. So yes, to answer your question.
Yeah. I have a lot of questions, and I don't expect them to be answered during this grocery tour, but I will tell you, Dr. Zhu, 7 years in eating this way, I now know from experience that when I buy a papaya, for example, it's going to be sitting on my counter for a few days before I can eat it. When I lived in California, very different experience. I could eat an avocado the same day I purchased it. Wait till you come out to Texas. Yeah. You buy an avocado and it'll be sitting in your fridge for a while. But I've heard that there are different ways of figuring out when it's ready to be eaten, along with bananas and even cantaloupe. Remember, like the whole cantaloupe, like they say you have to, knock on it or hit it to know. There are so many tricks to picking produce.
It's actually a Morse code. You have to knock on it. And the cantaloupe is supposed to respond back in Morse.
Yeah. You have to know Morse to understand the response.
Right. So, okay. So just recapping again, the grocery tour, and then we'll be back to the workshop venue where you'll learn some culinary skills and meal preparation. And, Dr. Zhu will talk a little bit about how to navigate your own kitchen by showing you how things are stored. And you'll see how I put together some stuff with that as well. And then we'll be sitting down and having a communal experience of just networking. Riz and I just finished a 4-part Blue Zone series, and community is one of the key things that the Blue Zones have. The longest lived people in the world value spending time together with loved ones. And we want to give you that experience. Most of us eat alone, for the most part. And most families don't necessarily always sit down at the table to dine. Mm-hmm. And so you'll have that experience. You get to meet each other, talk about your background. Kind of, I call it networking. We'll do afterwards biometrics, Dr. Riz, at some point, where you can, and by the way, this could be personal. So you'll have a separate space for doing the biometrics and speaking to people about what that means for their numbers. And then we'll just tell you again, we'll finish off by telling you how you can obtain your CE credits. And then, of course, we want testimonials. So if you're open to that, we'll have a waiver that you can sign. We would love to hear what this experience was like for you, because we'd like to continue to do this. Right, Dr. Zhu?
Yes, very, very much.
So, yeah, I'd like to comment on a couple of things that you both brought up. And first off, it's limited to 10 people. And that's really important. It's going to be a very cozy, intimate group of people, and that 10 people is going to have access. So it's not going to be this large crowd where you feel disconnected. You're actually going to, be in the action, participating in the shopping, but, more one-on-one interaction with the experts here. And so it's going to be a really meaningful experience as far as I'm concerned. Mm-hmm. And so I think these spots are going to go fast. So I wouldn't wait around. And and by the way, I want both of you to jump in and tell me what the value of this would be. So I'm just thinking, if I were to go out and have dinner with friends, okay, and the dinner is cooked by a professional chef. So we're talking about plant-based eating, and that's hard to find in Dallas, because we don't have a place where we can actually eat healthy food, healthy plant-based. But if I were to go out to dinner and on top of that, have a networking event that I attend and have my biometrics taken, and also learn how to do a grocery tour properly so that I can have the tools to, pick my produce exactly how I want it to be when I'm ready to cook those foods. Oh, and did I mention culinary skills? What's the value of all of that package? What would people pay if they paid separately for something like that? Oh, a lot more than what we're charging, I can tell you that. Mm-hmm. I just saw something online where a group of 10 can do have a plant-based meal cooked for them, and it was $150 a piece.
Yeah.
So just for the meal.
Just the meal. Dr. Zhu, what do you think the value of all of this is?
Well, I also want to add that, it is led by 2 board-certified lifestyle medicine physicians, 2 doctors, right?
Yep.
And it's an incredible value. I would say, at least $1,000 easy.
Yeah.
Yeah, exactly.
No doubt.
Yeah. And so the fact that you're getting all of this for $399 for a 5-hour workshop, plus continuing education credit.
If it applies to you.
If it applies to you, exactly. And so we're going to share, I'm going to add a link in the show notes, and I'll make sure I get it out there because we're still working on the details for the Eventbrite. But, and probably by the time this airs, we will have all that information, but look out for the link so that you can register. We take, there is going to be a list. When you look at the details of Eventbrite, you'll be able to see, I try to think of all the different questions that people would have, and I'll just throw some out there. I was trying to pull up my, I have frequently asked questions, so I'm just going to answer them real quick, not all of them. Who is this workshop suitable for? It's suitable for all individuals of all backgrounds with an interest in culinary experience. You don't have to have any experience because that's why you're coming to learn. Whether you're a healthcare professional, a food enthusiast like myself, or someone looking to improve their health through nutrition, this workshop is for you. Are there going to be hands-on cooking demonstrations? Will there be a immersive experience that way, Dr. Zhu?
Mm-hmm. Yes, it's going to be immersive. We're going to be cooking together. We're going to be leading 3 different types of recipes. Everyone's going to be working in the kitchen. And I think that's one of the best hands-on experience and methods of cooking is using all 5 senses. Demonstrations are great, very eloquent and very, a lot of glitz and glamour, but I believe it's more of a one-way experience. And so I want it to be a 2-way experience. And so there's a lot of interactivity.
Yes. Okay. Another question that people may have is this workshop suitable for dietary restrictions or allergies? We know that nowadays people deal with gluten sensitivity and nut allergies and all of that. Will we take this into consideration, Dr. Zhu?
I think it's important to take this in consideration. I do want to reiterate that, we are doing, whole food plant-based recipes. So people who are interested, not just in a culinary experience, but also in terms of learning how, I want to include more, plants in my diet. I want to include more, plant-forward, recipes. I have a loved one that's battling a chronic disease. How do I learn? So it's not just a culinary experience. It's learning how to use food as medicine in terms of optimizing one's individual health and or someone else's. So you're going to be learning that in totality.
Yes. So you'll be receiving an email from me when you register, and it will have a questionnaire. And one of the things that you let us know is if you do have any allergies, and we'll definitely take that into consideration. Yes. Okay. A couple of other things. What should I bring to the workshop?
An open mind.
Yeah.
There you go. Curiosity. And
appetite.
Appetite. Oh, that'll be nice.
How about a big knife? Or no, I think we're providing those.
No. We have the equipment. Yeah, they don't have to,
So you'll receive a folder with a goodie bag, but all the content that you'll need will be printed for you, and you'll have a place to write down your biometrics and take notes. So we'll provide like the pen pad or the notepad and the pen for you. So all you need to do is just show up and have a good time. Can children attend the workshop? So what we said is while the workshop is primarily designed for adults, we do welcome mature teenagers with an interest in culinary medicine and nutrition to attend, but please contact us directly if you have younger people. We actually are gearing this for adults. All right, another question. Can participants bring alcohol to the workshop? So to answer what I have written in the Eventbrite is, as the focus of the workshop is on culinary medicine and healthy lifestyle practices, we kindly request that attendees refrain from bringing alcohol to the event. This helps us to maintain a cohesive and health-oriented atmosphere throughout the workshop. Anybody want to add to that?
No, I think enough said.
Perfect.
Yeah.
Okay. All right. Dr. Zhu, please tell us about the early bird prize. When is the deadline for that? And then tell us again the overall price for those that don't get the early bird.
Yeah, so the main registration cost is going to be $3.99, and we've listed out the bullet points of what you're getting, and it's well more than $1,000 value. In terms of the early bird, we're going to price it at $349, and so the deadline for that is going to be July 1st of 2023. So it's a very limited amount of time, quick turnover. So it's a really first come first serve, and after July 1st, it's going to go back up to $399, and it's only 10 seats, and we're anticipating this to sell out pretty quickly.
I'm going to announce this workshop at the Dr. Lori Marvis event, because I know that we're going to have healthcare providers that we've invited, but we also have people that want to take the next step. Dr. Zhu, we talked about this before we even started collaborating, that people are hungry to come back together, and people are hungry for for more education on how to get started on a plant-based diet, but also just taking it to the next level, like the culinary experience. Now, I've been asking around how many people from our area are going to the Lifestyle Medicine conference, which is coming up at the end of, I think, October, and not that many people can fly out of town. They can't afford it, because we discussed earlier that to go to a conference takes not only the cost of the conference, but flying there, staying there, and also moving around. So transportation. We're making it easy. We're bringing the workshop to you. You get a taste of lifestyle medicine, culinary medicine from two experts that have gone the extra mile of studying lifestyle medicine and becoming board certified. So we don't have that in Dallas. We have Dr. Riz, and then we have Dr. Zhu that's coming in from California. And so this is the beginning of many things to come. I'm very excited about this collaboration. I think it's going to be nice. I have this feeling that there's going to be a demand for more.
Yeah, I'll tell you what, just talking about this right now is getting me all excited about it. I wish it was tomorrow so we could get it going.
Yeah, there's nothing that beats the live in-person synergy and camaraderie, rapport that's built up, when you have, because, I'm sure we've been zoomed out, in terms of, virtual everything, right? Mm-hmm. And so having something like this is very, very special. And I like the fact that it's limited, it's only going to be, one and done, and then we move on, right? And, we want to continue to have this and to bring this to the community. So, again, we're anticipating this to sell out, and I'm not even sure we're going to have a wait list. Are we going to have a wait list, guys?
Yeah, I think we can keep a little wait list, but it's such a small crowd that I don't think that's going to be, fruitful, but we'll keep one just in case somebody drops off. We'll keep a wait list
for the next one, for the next one, because who knows how often we'll offer these things.
Yeah, exactly. Yeah.
All right. Any final words before we wrap up?
I think it's never too late to take back your health, no matter where you are in terms of your life situation, your family. There's always every day is a new day. Okay. The fact that you're above ground is a good day, So, it doesn't matter, where you are in terms of your life, your health. You can always, get up, start learning the tools, reach out, seek help, seek support. And what better way to do this with, two great physicians, an amazing, just collaborative between the three of us, as well as joining a peer-to-peer, community with like-minded individuals and, who are maybe, going through similar life experiences in terms of, where they are in their health, where they are with their family, and where they are with their individual experience. So I think this is going to be a really, really fun event. We're super excited about it.
Yep. Well, I want to thank everybody. Dr. Riz, any final words?
Nothing much different. I just kind of echo the words of Dr. Zhu. I think that this is important for people at all points in their lives. I even tell my patients who have very advanced disease that it's not too late to change your habits and adopt a healthier lifestyle and learn these skills, because it'll make them healthier.
Yeah. What we're bringing to Dallas is lifestyle medicine. We don't have that. We'll be the first to bring you lifestyle medicine in Dallas.
Basically, our superhero team name is called the Lifestyle Wellness Experience. That is what we're going on together, the three of us moving forward. So we're going to be bringing hopefully a lot of different iterations, and this is the very first one. So this is very, very special for us, and we're excited to share it with the first 10 that sign up and register.
And the workshop again is called Nourish Your Health, Culinary Medicine Workshop. Friends, we can't wait to connect with you, to have you as part of this experience. So make sure that you look at the link, check below. And also you can always contact me, plantbasedmaya@gmail.com for more details on the workshop. And we look forward to meeting you in person. Thanks again for listening.
Thank you.
You've been listening to the Healthy Lifestyle Solutions podcast with your host, Maya Acosta. If you've enjoyed this content, please share with one friend who can benefit. You can also leave us a 5-star review at ratethispodcast.com/HLS. This helps us to spread our message. As always, thank you for being a listener.